It's the conversation no one wants to have, but everyone needs to have. We're talking about Advance Directives, the way you want to be cared for as you approach the end of life. Dr. Matt Frantz is here to help us begin this conversation. Dr. Frantz is in family medicine with MetroHealth. Welcome to the show.
Thank you.
Now, you've seen firsthand what can happen when that conversation hasn't taken place.
Certainly. Far too often do we have patients in the hospital that are at the end of life and they've suffered a severe stroke or they have advanced dementia, or they have some kind of life-ending or life-near-ending event that ends them in an intensive care unit or in an area of the hospital where they're in dire straits. And a lot of these times, these patients don't have a chance of getting better, or their issues are to the point where we really need to start talking about end-of-life issues.
Yeah, and not everybody has done that, and it's hard to do that.
It's a very hard thing
when
to do.
a loved one is there laying in that situation, it's hard not to say, "Oh, keep them alive,"
Right, and we see that on a weekly basis where somebody comes into the hospital and not that we didn't know the event was going to happen, but they didn't prepare themselves for the event. A lot of the 60% of the healthcare dollars spent in the last 6 months of life, and that's resources that sometimes we utilize in instances where there really is no hope, and for people who quite honestly wouldn't have chosen to be in that situation if they had the opportunity to have said something about it. When somebody's in a coma state, they can't come back and say, "Hey, listen, I really didn't want this procedure done, or I didn't want these things done to me," and sometimes we're forced into doing things that as physicians and as nurses we aren't comfortable with. So.
And I suppose sometimes the family is not all there together all the time. There's somebody who hasn't been a part of any conversations whatsoever who might make things more difficult.
Absolutely. Some family members that are near and close, sometimes they can watch the eventual deterioration of a patient and they understand this is a natural event. Dying is part is a normal, natural part of life. I mean, like it or not, we're all taking that journey at some point in time. Nobody gets out of this place alive, is how they put it.
So we know that. How do we start that conversation, though?
I think it's important to have that conversation with your family members. There's plenty of opportunities where the families are together, and it sounds like a morose conversation, but it doesn't necessarily have to be. When you're in good health and you can sit down and open that conversation with your family, you can say, "Listen, I don't plan on going anywhere anytime soon, but at some point in time, these issues are going to become important, and I want you to know how I feel."
And that's when you can talk about DNR and do not resuscitate orders?
Do not resuscitate orders. Those are very important. Do not resuscitate orders are orders that we use in the hospital that there's two major ones. There's do not resuscitate comfort care, and there's do not resuscitate arrest. And there's subtle differences between the two, but those are the terms that we use to signify that no, we're not going to come in and put this patient on a ventilator, and no, we're not going to come in and shock this patient, and no, we're not going to come in and start compressions to the point where we're causing actual damage and pain to the patient.
Okay, so it sounds like a discussion with the physician, maybe from the family, and then the family all together to make these final choices for end of life.
I think every patient should talk to their physician at some level and tell them what they believe in and what they want at that point in time in their lives, and then should carry that conversation back home and talk to their entire family, because it's going to be the one family member that they haven't seen in 5 or 10 years who comes out of the blue and says, "No, wait a minute, let's do everything."
Yeah.
And
that doesn't help anybody.
That's
not what anybody
wants.
It's
very counterproductive.
So,
correct.
No one wants to talk about the time when we could lose our parents or when we ourselves are at the end of our lives. But not talking about it only makes things harder for those who are faced with end-of-life decisions in our places. So you got to have the conversation now so that you'll know what needs to be in place later. My thanks to Dr. Frantz for helping us begin this difficult discussion.
To learn more, call MetroHealth at 216-778-7800 or log on to www.metrohealth.org.